Hello, and welcome to another edition of a remote Chairside Live. I'm Megan Strong, coming to you from my very fancy in-home office.
And I'm Will Schmidt, registered dental assistant here at Gladwell Dental, coming at you from my fancy in-home office.
Thank you so much for being with us today. We hope you're staying healthy and taking advantage of the daily webinars. They're 1 hour long with 30 minutes of presentation and 30 minutes of a Q&A from experts in the dental field on glidewelldental.com. We hope you're taking advantage of those. But in today's show for Chairside Live, I'm the patient. Yes, you heard that right. After experiencing some pain in the area of number 13, I went to see Dr. Taylor Manalili. And it turns out that the congenitally missing tooth that I had with the previously restored implant that was there, well, that implant was failing. So,
You know, poor thing, it sure was. And so you became the subject of this case. So Dr. Manley had to remove the existing restoration and the implant, place a new implant, and then we had some different temporization options for you to choose from.
you sure did. So I'm excited to see how I fare in Dr. Manalili's chair. But spoiler alert, I was in great hands and I'm no baby. Let's check it out.
So, can you see this? Yep, implant's loose, took off the crown. Now we're taking out the implant, just drilling into the bone.
So it looks like I'm about to have a baby, or deliver a baby, or do something. This is a good look. Loving it. Who's nervous? Not me. Yeah, it's gonna be good.
Megan presented to our office with a recent history of discomfort in the upper left quadrant. Upon clinical and radiographic evaluation, it became apparent that an implant that was placed and restored several years ago by a previous provider was now unfortunately failing. The restoration itself was cement retained, and when the crown was removed, it was revealed that the head of the prosthetic screw had been stripped. On top of that, I was not 100% sure what implant system we were dealing with. This really left me little choice but to cut the restoration off and remove that ailing implant. I would like to take a minute to highlight one of the features of the existing implant that may have led to this failure. Let's take a look at the thread patterns. Notice the implant on the left, which is Megan's current implant, the threads are shallow and very few in number, leading to a higher pitch pattern. This simply means that there is a larger distance between the threads. Now let's compare this to the implant on the right, which is what we're replacing it with. This is a Hahn tapered implant. So notice this implant has deeper and more numerous threads. Studies have shown that implants with more threads, or what we call a lower pitch, have a higher percent of bone to implant contact, leading to a stronger resistance to vertical loads, a much more desirable quality when selecting an implant. Okay, let's go back to Megan's case. Since the existing implant was moving in the bone, I was able to easily use a hemostat to help reverse the implant out. Once it was removed, we thoroughly rinsed and evaluated the site. This is what one of my mentors, Dr. Kurtz, refers to as a dry failure, meaning no visible infection, just a clean, dry site. On one hand, this is great because we are not worried about purulence or granulation tissue inside the osteotomy. On the other hand, we have to make sure we reintroduce blood flow to the site, whether we decide to graft or place another implant. We are hoping to place another implant today. Therefore, the easiest way to do this is to use our shaping drill. This drill will help us ensure our osteotomy is the correct shape while exposing fresh bone, allowing blood flow to this area. This blood flow will bring with it the necessary growth factors that we need for successful integration. From here, the Hahn tapered implant easily torques into place as the aggressive buttress thread pattern and self-tapping grooves help provide the primary stability we are looking for. I chose to put a cover screw on this implant as I want to eliminate any possibility of shear forces on this implant as it osseointegrates.
So it happened, and now the lips are. The lips are a situation, so
But you got your implant in.
yeah.
Right.
Since this is Megan, who loves to smile and talk, we can't leave her without a tooth in her maxillary premolar spot. However, we have to weigh our provisional restoration choices. 1. We could give her a flipper. I don't really like this option as it could potentially put unwanted pressure on our healing site if we do not properly relieve that intaglio surface. Additionally, it could affect Megan's speech, something we cannot really afford to let happen. 2. We could give her an Essex. This solves the problem of putting pressure directly on the healing site. However, it still takes time for Megan to get used to speaking with an appliance like this. Time is just not something we have at this moment. Another option could be a smile transition. This is a great option if we are aiming to provide additional smile improvements somewhere down the road. This appliance is fairly comfortable and very aesthetic, giving the patient an idea of what a complete smile makeover could look like. However, with Megan, we really like her current smile, and therefore we decided to go with our 4th option. So our 4th option is we decided to bond in a milled Biotemp Now to the adjacent teeth. So we're essentially creating a chairside provisional Maryland bridge. So we did this by scanning the site. After scanning the site, we were able to design and mill a Biotemp Now restoration and bond on the provisional using fiber and flowable composite just to the adjacent teeth. So with the provisional like this, it is important to minimize occlusal forces as much as possible if you wish for this to be successful. So in under an hour, we were able to replace a failing implant and provide our patient with a provisional that is aesthetically pleasing with thankfully minimal effect to Megan's speech. And with that, thank you for having me today. Let's head back to the studio and thankfully hear from Megan and Will one more time.
Thank you so much, Dr. Manalili. I am so grateful for your expertise and care.
No, and it was fun helping out Dr. Manalili and Michelle, her RDA, on your case. But Megan, before we go, I want to remind everyone to head over to gladwelldental.com for daily, free, 1-hour special webinars to help provide you with that extra support and education as we overcome the COVID-19 pandemic.
Yes, it's a great resource, and we're so happy that so many of you are already taking advantage of it, and we encourage you to do the same. But on behalf of everyone here at Gladwell Dental, thank you so much for watching.
For now, be safe, and we'll meet you right back here next time.